Welcome to the Policy Visibility Drive, a Ghana Health Service policy initiative created to shed light on existing policies within the service. This month, we'll be focusing on the following policies: the Patient's Charter, the Ghana Health Service Staff Welfare Benefits, and the Workplace HIV and TB Policy 2020. In this presentation, we will concentrate on the Ghana Health Service Staff Welfare Benefits. The Ghana Health Service employs about 70% of the total health workforce across the country, a current total of 84,952 employees. As a service, one of our guiding principles is to uphold the dignity and welfare of all our employees. The staff medical benefit is intended to be established as part of the overall employee welfare services. As of now, issues such as several requests for support, the medical needs of retired staff, long approval processes, and budget constraints have had a negative impact on the health and well-being of employees. In order to ameliorate the situation through the staff medical benefits, a concept note was developed and approved. The Welfare Association Constitution was developed, and the benefit was modeled. The purpose of the Staff Welfare Association is the provision of medical benefits to specified critical illnesses suffered by covered members which are outside of the National Health Insurance Scheme. Our objectives today are to promote solidarity and mutual cooperation, to offer financial support to improve members' access to medical treatments of conditions through risk sharing, and to seek financial aid and grants to further the purpose of the welfare. The Director General shall be the patron of the welfare. Mode of contribution. Principal members shall take monthly contributions of 1% of their basic salary to the association. Contributions of members deducted at source shall be paid into a dedicated account for the association. In the case of non-mechanized staff who register with the association, contributions will be deducted by their facilities. With a 1% monthly contribution to the welfare, even for a number of years, one episode of a disease outside the benefits package of the National Health Insurance Scheme may be over the personal budget of the average service staff. This is why the staff welfare benefit is so important, because it ensures the ease of financial burden of a member during a disease or illness episode. Regarding membership, members of the service who retire after the inception of the association, any other employee at the Ministry of Health and its agencies who goes through the process of joining the association in accordance with the provisions of the Constitution and the internal regulations. No person otherwise eligible for membership of the association shall be denied membership. A person ceases to be a member of the welfare where the person withdraws his or her membership, has his or her membership revoked on any grounds, or dies. Given the voluntary nature of membership of the Staff Welfare Association, it is important to note that in the event of debilitating disease outside the benefits package of the National Health Insurance Scheme, the staff will be subjected to the regular system. Note that any delays in the regular bureaucracy can cause further complications or death. There will be no remuneration for officers of the welfare. However, all reasonable expenses such as expenses on meals, accommodation, and transportation will be catered for. Beneficiaries will be as follows: principal member, spouse, 3 children under the age of 22. In the case of retirees, premium is completely weaned off after retirement. The retiree must have contributed to the association at least 60 continuous months prior to his or her retirement. Benefits is the amount payable on the medical expense arising from an injury or a catastrophic illness of an eligible member and subject to the terms and conditions of the association. The following are included in the benefits package for medical treatments: cancer treatments, heart surgery, organ transplant, orthopedic surgery, laparoscopic, spine surgery, urology and nephrology, ENT surgery, ophthalmology and refractive error surgery, neurosurgery and neurointerventional surgery, dental treatment, as well as medicines on the essential medicines list of Ghana are not covered by National Health Insurance Scheme. The welfare will not recognize requests for any of the following: all benefits covered by the National Health Insurance Scheme, charges for which a covered member is not legally required to pay, charges above predetermined charges by the welfare, services and supplies not recommended or approved by a doctor, change of life or cosmetic or aesthetic treatments inoculation or immunizations related to travel, congenital external disease or defects or anomalies, intentional self-injury and ailments arising out of chronic use of alcohol or narcotic drugs, expenses on vitamins and tonics unless forming part of treatment for injury or diseases as certified by the attending physician, injury sustained or an illness contracted while committing a crime, surgical procedure and medical treatments for weight reduction, VIP room charges beyond the amounts normally charged for a standard room, replacement of braces or prosthetic devices and support garments, reversals of sterilization products such as vasectomies and tubal ligations, treatments for which a third party may be liable.
Please note, this presentation only contains an abridgment of the policy document or publication. To access the full document or for further reading, kindly visit the service website at www.ghs.gov.gh. Thank you for your time and attention.